At PHRC, we often get questions through our social media platform or through our virtual services from patients who are undergoing treatment for their pelvic pain, but they're just not getting better. They're not seeing the results that they would hope for. So the next few minutes, I'm going to review some of the top reasons why your treatment may not be as effective as you're hoping, and some of the reasons why you may not be getting better. So I think the first thing you have to ask yourself is, are you confident with your diagnosis? Do you feel like you and your medical team have really correctly identified the cause of your pelvic pain and that you've developed a comprehensive treatment program based upon identifying those primary pain generators, and you have a treatment plan that is working to resolve those primary pain generators? Next, do you have all the members of your medical team that you need in order to carry out an effective treatment program? This may include a physical therapist, a gynecologist, a urologist, a pain management specialist, and a mental health therapist. Missing one of those necessary medical providers could inhibit the progress of your treatment plan. Next, are you implementing all of the recommendations and modifications that your physical therapist has identified and recommended for your daily activities and exercises? For example, if your physical therapist made recommendations on how to modify some of your exercises, or maybe how to modify some of your daily activities, if you're not carrying through with those recommendations, that could be a reason why you're not progressing at the rate you think you should. Typically, pelvic floor physical therapy is prescribed 1 to 2 times a week for pelvic pain. If you're seeing your physical therapist less than that, that may be a reason why you're not progressing. It may not be at a frequency high enough to make significant changes and see those desired changes in pain. The next is about your home program. Your therapist has most likely prescribed you a program of exercises to complete at home in between your in-person treatments. If you are not completing that home exercise program correctly, that could be impeding your progress. Another reason is, are you still straining to have a bowel movement? Many people don't realize that every time they strain to have a bowel movement, we're actually tightening our pelvic floor muscles, which could cause further dysfunction and exacerbate pain. And we're also putting strain on the pudendal nerve, which is the primary nerve of the pelvis, that could also be contributing to your pain. So if you're still straining to have a bowel movement, that is a behavior that you need to modify immediately to help decrease your pain. Another reason could be anxiety. If you are suffering from severe anxiety and you're not sure how to manage it, it may be time to consult with a mental health therapist. If that anxiety significantly and negatively impacts your pain, it definitely needs to be addressed. If you implement something at home, you could start a mindfulness meditation practice at home, and that can help to reduce your anxiety. Are you suffering from menopause or perimenopause? If you are, the changes that happen during menopause can affect our pelvic floor muscles, our genitals, as well as the nervous structures in our pelvis. And if you are not addressing those symptoms of perimenopause or menopause sufficiently, it could negatively be impacting your pelvic pain. So be sure to consult with the right medical provider to be sure that you are addressing all those symptoms of menopause or perimenopause that may be contributing to your pelvic pain. And lastly, do you have an undiagnosed condition? So conditions such as endometriosis or yeast infections in the vagina, or even food sensitivities can cause pain and inflammation in organs or viscera that can contribute to pelvic pain. So if you think you have an undiagnosed condition, be sure to consult with the right medical provider, as that may be one of the reasons why your pelvic pain is not resolving. So if you're undergoing treatment for pelvic pain and you just don't feel like you're progressing at a sufficient speed, or your quality of life has not improved, And if you tick one of these boxes that we've just reviewed, or if you feel like one of these things that we've just discussed describes you, talk to your physical therapist to see how you can resolve that and get on the road to recovery.